Hello all. Today in this topic we are going to discuss about arthrography. Arthrography is a radiographic imaging procedure in which a radio-opaque contrast media is injected into the joint cavities to study the joint abnormalities. If the patient is having any abnormalities associated with the soft tissues, so we used to see through the arthrography procedure. The arthrography is most commonly performed for the joints of synovial joints such as shoulder joint or elbow joint or either in wrist joint, hip joint, knee joint and temporomandibular joint. For such joints, arthrography procedure is taken to visualize any abnormalities in the joint cavities. So arthrography can be either direct arthrography or indirect arthrography. In indirect arthrography, the contrast media is injected into the bloodstream. Through the bloodstream, the contrast media will get flow into the blood vessels through the joint cavities, and the images will be taken after a specific period of time. For example, in CT scan images, in CT scan machine, the arthrography will be performed well. Next is direct orthography. In direct orthography, the contrast media is directly injected into the joint cavity and the images are taken immediately after the injection of the contrast media. So these two types differs according to the patient's capacities. Next, indication is nothing but the patient will be having joint pain or inflammation either in the particular region of that joint cavity. Next, tear of any joint capsule, a rupture of any ligaments and dislocation of joints. So these are the indications in which arthrography procedure is being performed. And contraindication, as usual we have discussed, is nothing but if the patient is having any allergic reactions to iodine sensitivity, and if any suspected pregnancy, and if the patient is having any asthma or diabetes and recent joint fractures. So in these cases, the arthrography procedure will not yet be performed. Next, patient preparation is as usual, like the patient will have to be insisted to take a low residue diet for 2 days prior to the examination, and the patient is asked to drink n number of fluids, plenty number of fluids on the day before the examination, and fasting is mandatory. The patient have to be fasting for 6 to 8 hours prior to the procedure. It is better to inform the patient not to eat or drink after midnight. Women should inform if they are having any chances of getting pregnancy or if there is any possibility of getting pregnancy, because the radiologic examination will be a high risk to the pregnancy patient. It will affect the fetus also, to the unborn baby also. Next, the patient is instructed to remove all the metal objects and the patient is asked to wear the hospital gown. The most important thing is the insertion site must be well cleaned and shaved before the examination. Equipment is nothing but fluoroscopy equipment with spot film device is used. Arthrography tray, which is a sterile tray which is used to do the procedure. In that tray, the following things are included. Gauze must be there, sponge, a syringe which is of 50 cc, 20 cc and 10 cc syringe must be there. Local anesthesia should be given. Antiseptic solution should be present. Spinal needle, 18 gauge spinal needle should be there. Contrast media should be there, and all such things are positive things. And if negative contrast media is nothing but carbon dioxide or room air in the temperature of 80 to 20 200 cc, the negative contrast media also should be present in that equipment. Next procedure, on the day of the examination, the radiologist or the technologist have to describe the whole procedure to the patient, and they have to get a written consent from the patient for the permission to do the procedure. After that, the patient have to be in the hospital gown, and the patient is placed in a supine position in the fluoroscopic table. After that, an intravenous line is injected and the sedatives are given through the patient's intravenous line to make the patient relax. After that, a plain X-ray of the specific joint. For example, if the patient is having inflammation or the patient is having any pain in the shoulder joint, we are going to visualize the shoulder joint. That particular joint will be given, will be taken up a plain X-ray, and after that the insertion site at the shoulder joint must be cleaned with the antiseptic solution under sterile protocol, and draped with, it should be draped with the sterile towel. Afterward, a local anesthesia will be given at the insertion site. After numbing the area, the radiologist will insert a spinal needle, that 18 cord spinal needle will get inserted into the particular joint cavity with the guidance of fluoroscopy. After insertion of the spinal needle, what they will do in a sense, the patient, the radiographers will slowly inject the contrast media into the spinal needle subsequently. After injecting a number of contrast media, what they will do in a sense, they will take the images. So, for example, if the patient is having any complications in the shoulder joint, then or else in the hip joint, the hip arthography procedure will be performed in this manner only. The spinal needle will get inserted into the hip joint as it is shown in the figure, and the contrast media, for example, up to 20 to 30 ml of contrast media will get pushed into the patient joint and the particular joint cavity, and spot films will be taken. After spot films are taken, what they will do in a sense, they will remove the spinal needle and they will clean the particular inserted site, and what they will do in a sense, after cleaning the needle, they'll apply some ointment, and they'll make the particular region kept a fully dressed, and they'll check the patient. The patient will be kept under observation for more than 6 hours. If the patient's vital signs are normal, for example, if the patient's BP, heart rate and pulse rate are normal, the patient will be allowed to leave the examination room, and the patient will be instructed to drink a number of fluids, and the patient will be asked to be in a bed rest for at least 6 to 8 hours after completion of the procedure. And complication is nothing but the patient will be having a slight pain at the insertion site. Inflammations may occur due to the contrast which has been injected into the patient's joint cavity. So that's all. Today's class is over. Thank you.